The transition from classroom learning to real-life patient care is one of the most significant milestones in nursing education. For Level 2 nursing students, the first clinical rotation is both an exciting and challenging experience that exposes them to the realities of the healthcare settings. During this period, students encounter new responsibilities, unfamiliar environments, and emotional pressures as they begin applying theoretical knowledge and nursing skills to actual patient care. This study, Awakening the Nurse Within, lived experiences of Level 2 nursing students in their first clinical rotation, explores the thoughts, feelings, and challenges faced by students during this crucial stage. By understanding their lived experiences, this study aims to highlight how initial clinical exposure shapes their confidence, resilience, and professional identity as future nurses. Before we proceed, I would like to introduce myself. Together with my group mates, I am Eldie Omandac Jr. Together with me, I have Jona Moguad, Margarette Morales, Justine Klyde Morillo, and Jeremy Justine Oraa. The purpose of this study aimed to explore the lived experiences of Level 2 nursing students in their first clinical rotation.
This section explains how the study was conducted. The researchers used a qualitative phenomenological research designed to explore and understand the lived experiences of Level 2 nursing students during their first clinical exposure. This approach focused on how students personally experienced and interpreted their situations. A total of 10 Level 2 nursing students participated in that study. They were selected using purposive sampling, meaning they were chosen because they had relevant experience in their first clinical rotation. The participants included both male and female students who met the set criteria.
This study is significant to several groups. First, for institutional administrators, it provides insights that can guide policy, curriculum improvements, and resource allocation. 2. For nursing faculty, it highlights ways to strengthen teaching, mentorship, and student support during clinical exposure. Third, for the parents and guardians, it offers a better understanding of the emotional and academic challenges students face. Fourth, for the nursing students, it provides realistic expectations, motivation, and confidence as they prepare for clinical duties. And finally, for future researchers, it serves as a foundation for further studies in nursing education and clinical experiences.
For the first theme, we have fostering emotional adaptation among Level 2 nursing students during the first clinical rotation. For the first sub-theme, feeling initial fear and self-doubt, many participants shared that before starting their duty, they felt nervous and unsure of themselves. Some mentioned having a fast heartbeat, worrying about making mistakes, and questioning if they were really prepared to perform even simple procedures like taking vital signs. For the second sub-theme, we have overwhelming emotion and clinical situation. Students described their first clinical exposure as a mix of excitement and anxiety. They were really excited to finally experience real hospital duty. They also felt overwhelmed by the busy ward environment, the number of patients, and the real fast work of the nurses. And we have the third sub-theme, we have experiencing emotional adjustment during the first clinical exposure. Even though students initially felt anxious, they gradually started to adjust. They became more careful with their action, double-checked their work, and slowly gained confidence while interacting with patients.
And now for the third theme, adapting emotionally from adversities. This illustrates how nursing students were able to grow stronger despite the challenges they encountered during their first clinical rotation. Through repeated clinical exposures, they gradually built resilience and became more confident in performing nursing responsibilities. They also learned to adjust to the fast-paced and complex clinical environment while developing effective coping mechanisms to manage their stress, fear, and anxiety. Overall, this theme highlights the students' emotional growth, adaptability, and increasing readiness to take on their future roles as competent and compassionate nurses.
Our second theme is entitled Engaging Challenges in Skill Application and Clinical Performance. This theme highlights the real challenges nursing students face as they transition from classroom learning to actual clinical practice. Many students experience difficulty applying theoretical knowledge, performing skills confidently, and adapting to the fast-paced hospital environment. As one student shared, it felt so different. These were real patients and real responsibilities, showing the reality shock during first exposure. Under this theme, 3 key challenges emerged. First, students struggle to apply nursing theories into practice, often feeling unprepared and unsure despite prior learning. Second, there was a strong fear of committing errors as students became more aware that mistakes could directly affect the patient's safety. This led to hesitation, anxiety, and constant double-checking of tasks. Lastly, students had difficulty adjusting to the clinical environment and workflow, describing it as fast-paced, overwhelming, and unfamiliar. Guided by Patricia Benner and Sister Calista Roy, these challenges are seen as a natural part of learning and adaptation, helping students grow into more competent and confident. In conclusion, this study explored the lived experiences of Level 2 nursing students during their first clinical rotation, focusing on their transition from classroom learning to real-world practice. The findings revealed three key themes. First, students experienced strong negative emotions such as fear, anxiety, and self-doubt when facing real patients and responsibilities. Second, they encountered challenges in applying theoretical knowledge into practice, performing clinical skills, and adjusting to the fast-paced healthcare environment. These difficulties often affect their confidence and performance. However, the third team showed that over time, the students were able to adapt emotionally. Through experience, peer support, and preparation, they developed resilience, coping strategies, and greater confidence in their skills. Overall, the study concludes that the first clinical rotation is a transformative journey from uncertainty and fear to growth and professional development. These challenges play an important role in shaping students into competent and confident future nurses.